from inception up to this one. This happens to be the last one for this year, and we hope you've actually had a very interesting and experience with all the CPD. Let's have the chairman, Acted Biodun Fatuyi, give us talk, please.
Thank you very much, General Secretary. I want to use this opportunity to especially thank every one of us that has always been religiously attending the CPDP classes. We know that it's just a method for us to keep learning and keep trying to understand the new trends in our profession, as the case may be. What I can assure you is that next year's series is going to be richer than what we have done this year. The concepts of the CPDP was to also bring in our members who badge doctorate degrees and to talk to us about their experiences and about the topics that they have mastered to become doctors. That's why we have Dr. Adeyemi Olabode here with us today. I'm hopeful that after this, we'll learn a lot about the health sector, and I'll leave him to do justice to the topic. Why will we start immediately now after this speech? I want to just specially thank everyone again for being with us throughout this year's series of the Continuous Development Program for NIA Lagos State Chapter. It's been a long one for the year. I'm sure next year the Education Committee will bring in more and more for us to enjoy together. Thank you. General Secretary, please.
Okay, thank you very much, Chairman. So, the profile of Dr. Adeyemi Olabode Afolabi, MNIA ICIOB. Dr. Adeyemi Olabode Afolabi is a seasoned architect and scholar with a rich academic and professional background spanning architecture, real estate, and healthcare facility design. He obtained his BSc Architecture in 2001 and Masters of Architecture (MArch) in 2004 from the Obafemi Awolowo University, Ile-Ife, Nigeria. In pursuit of advanced knowledge, he earned a master's degree in real estate investment and finance in 2006 from the National University of Singapore, broadening his expertise in the financial and investment dimensions of the built environment. Dr. Afolabi completed his PhD Architecture in 2005 at the University of Lagos, Akoka, Nigeria, with a specialization in healthcare facilities planning and design, a critical area of architectural research and practice with direct impact on public health and well-being. Professionally, he attained full membership of both the Architects Registration Council of Nigeria, ARCON, and the Nigerian Institute of Architects, NIA, in 2010, affirming his status as a licensed and recognized practitioner. He is also an incorporated member of the Chartered Institute of Building, ICIOB, further underscoring his multidisciplinary competence. With over 2 decades of cumulative experience in professional practice, public service, and research, Dr. Afolabi continues to contribute to the architectural profession through innovative thinking, thought leadership, and a strong commitment to advancing architectural design, particularly in the evolving field of healthcare facilities. Thank you so much for joining us, Dr. Adeyemi Olabode Afolabi. You have the floor, please.
Thank you. Good afternoon, everyone. Hello, can you hear me?
Yes, we can. Hello? Please go ahead. We can hear you.
Good afternoon, everyone. Mr. Chairman, Nigeria Institute of Architects, Lagos Chapter. Architect Fatui. Thank you so much for this opportunity. For the entire crew, executive of Nigerian Institute of Architects Lagos chapter, I appreciate you for having me to present a area that is of very importance in this current dispensation. And thank you so much for the privilege. I so much appreciate. Now, let's go down to the business of the day. Yeah, the topic before me that to present here today is emerging trends for architectural design in healthcare facilities. These are an area that is very important to our society at large, and of course to Nigeria in particular, which we've been trying to go into the extent of really understanding truly how we can promote the health and well-being of our populace. It's a very important area of architecture, which I think it's a good way to present to us what is happening in real architectural healthcare sector. What are the drivers of the healthcare architecture really for the future outlook? We are looking into the empower patients, prevention of lifestyle disease, rise in alternative therapies, increase in focus on acute care, of course, and the personal control. We're also looking at a new disease that is, of course, coming on in the events of the social economic changes in the whole populace, like climate, global warming, climate change, and in fact, why technology and the like AIoT is becoming more vast in our society. One can never do without upgrading the architect to know really this special care of how to defend or to work on the area of this particular special system. While we're just to describe, to digress a little bit, if we are giving, I know this will be of a major importance to everyone, especially the architects. Given a design of hospital of the future, what comes to our mind when we're giving a particular brief by our clients? That's okay, I want a design of a hospital for the future. In just one word, what will your guiding concept be? Everything in our mindset, of course, we'll be thinking of functions, functional design. We're talking about sustainability. We can talk about adaptability. And of course, we're talking about patients, which is a very important component of design of hospital itself. The healing center that we have is a recovery hub for a patient that to come and don't feel that you don't need to contribute to the problem of the patient, but of course to help realize what the patient comes to the hospital to do or to the health facility to do. We must of course contribute through our design on how to help the recovery process, and of course, apart from the medical knowledge being performed by the physician, which are the doctors, we as an architect have a point of duty to come in and to also let our design speak for ourselves and also to contribute to patient well-being. Now, the agenda for today, we'll be looking at the healthcare architecture in the broader terms, importance of healthcare facility design, key emerging trends, which is the major content of today's presentation. Of course, we are looking into some case studies where those trends have been input into their design strategy, then some challenges and implications for Nigeria as a whole, then the future outlook. Healthcare architecture. Healthcare architecture refers to the design of healthcare facilities, including hospital, clinic, care homes, and medical offices and long-term care facilities. This is a special design, a special system design, and what makes the healthcare design special is, of course, what you need to integrate to your design to make it a reality or to make it possible for the patient or for the staff working in the hospital to really benefit from your design. And what are those things specifically? Infection, defense of infection, 2, safety, And three, the personal experience, home-like duty that each patient will be experiencing in this particular hospital. Can we just look back, and whenever we go to the hospital, we see some certain things that is adding more stress to the stress that has been established already in the body. One, with all fairness and all the fair growth in everybody going to the hospital to experience some things that are even bad. And before you know it, you could even come back to home or come back home from the hospital with more disease and more ailments. So those are the things that, as an healthcare architect, you play a crucial role in shaping the environment that will foster healing while meeting stringent demand of modern care delivery. Why does this design of healthcare matters? To improve patient outcome and recovery rate. Of course, your design should contribute to improvement of patients. Patients come to the hospital because of a problem, and our buildings or our facility being provided for the patient to recuperate faster should be incorporate some design factors or design element that should hasten up the recovery process of the patient. Of course, enhance staff productivity and well-being. Then especially support infection control, reduce operational costs through efficiency, and ensure adaptability. A particular case of adaptability is a case of COVID-19 pandemic. Some hospital design were so rigid that couldn't contain the surge in the patient drives of the infection. So they need to walk around and open the canopies or open a emergency building tent for them to take care of it. An hospital, a good hospital design should come up in a focus that it should be adaptable, it should be flexible, so that it can contain several patients, so that we can take care of their needs whenever they are coming on board. We'll be looking at the trend that we hasten up our design, or we contribute to design, or an architect should look into this while designing an hospital building. It's not a matter of just putting pen on a pencil on a paper and just drafting like a solid building that we should go. There must be some factors that must be considered before going in, and these are the trends. The trends that people, it's coming off obvious that will be need in the nearest future for hospital to have a sustainable hospital design. Uses of natural light. We have something we call biophilic design, which concerns natural ventilations, organic forms, then plants and gardens, which is of course important in recovery of a patient. Private room for quiet zones, intuitive wayfinding. Wayfinding has becoming a very serious problem for even the staff and the patient in the hospital building. A wayfinding is how to get to your place or get to a particular area in the hospital building without even getting yourself confused. And then, of course, designing a mental health support and dignity, which will cool off the stress, a calm environment to promote health and well-being. Trend 2, flexibility and modular design. In order to make it very flexible, of course, we have some architectural design that shall not be so rigid in hospital planning. One of the element or factor that should be considered is flexibility in your design. It must be have a multi-use space adaptable for emergency. In case it should be a flexible that you can, of course, use it as multiple uses whenever you are. And what are the material that should be considered when you are designing, and at your back of your mind should be a prefabricated modular construction for fast development, because you can arrange, rearrange, and of course rearrange it to suit the particular need of the patient. Of mobile and temporary unit for rural outreach, which is a mobile clinic, which is becoming more of the trends nowadays. You get it in the modules, and of course getting it closer to the patient or getting it closer to the rural area where it will be used. The trend 3 is smart sensors. Of course, the most smart buildings are of importance nowadays. Technology integration is becoming more important into. We have smart buildings, smart residential apartment, smart IoT for real monitoring. Hospital design too should have a component of this touch. which should be able to encourage about telehealth, talking about automation, data-driven system, and of course, giving it adequately, because there are those are days where you have to design and you'll be moving from one room to another to see a consultant, or to move to one to see an examination room, pharmacy. In this system where the flexibility coming with technology, everything coming hand in hand, and these digital infrastructures have really equipped the hospital environment to be more efficient and productive in every way. Spaces for telemedia also is not left behind for virtual consultation. Trend 4, it must be sustainable. Nowadays, the energy efficient system, which is about energy conservation in buildings, it's of high importance, and this must be at the back of the architect's mind whenever it's designing, and it's one of the trends that really contribute to design and make the hospital building efficient and really serve the purpose. Cross ventilation designs, locally sourced material for the building materials, local recycled steels. When you're talking about, especially the local material that can make our building sustainable, we should go green, which will, of course, will help the building become more sustainable and more resilient for resiliency, capacity to adapt during disaster and pandemic. Trend 5, a behavioral health or mental well-being of the patient and the users of the hospital shall be at the back of the mind of the architect too. These are the people that needed to be considered whenever you are designing. Integration of mental health spaces in general hospital is of important. Trauma-informed design. When we tell trauma-informed design, what do we mean? Something that can cool up the patient, that can even be very important of people out of different stages. And majorly, the different behavioral patterns should be studied effectively to make it more robust in your design while you are even planning for a dignity, safety, and comfort. Because this particular trend is quite of important, because it gets used to what building can contribute and to form the system or to form a part of the patient, which will of course contribute to the recovery process of the outdoor areas and privacy for emotional recovery, that is access for nature's quiet zone, etc. Trend 6. We are moving from normal the conventional way of designing hospital. We are making it more robust in terms of home-like. When you are at hospital, you don't need to find a difference between when you're in the hospital and at your home. Make it comfortable, because part of it is a style, what has been developed. When you are going a residential style of furniture, they go to create comfortable environment for the patient, cool and inviting colors, lighting features and suitable for homes, and less clinical. We make your design look less clinical, so the patient will find it comfortable, safe, and even enjoying every bit of his stay in the hospital, not to have to ease our problem anyway. Trend 7, healthcare spaces that needs a diverse set of patients. In terms of diverse patients, we have different populations, patient population, old, new, male, female. This has to be considered when you are designing. You make sure that the spaces that meet the needs of their diverse set of patients are actually put in place, so that at the end of the day, the real intent, the real reason why you are getting the design done is really to make the environment safer, comfortable, and even to help help the physician or the doctor in contributing to the patient recovery period. Most of the trend that have been talked about is highlighted in every design, and these are the things that should be placed at the back of our mind whenever we are designing for a healthcare building. Children are not left out. A kid-friendly should also be considered when you are considering this particular part of design, pediatric hospital, where you make it a fun, don't make it a very not scary, and it should be of fun to children, especially when coming to the field. This should help the architect or the designer to incorporate those features of kids into this design to help them about their activities and make it a playful session whenever they are coming, and it should not be a place of a space that will really terrorize the children or make it a scary place for them to come over. Trend 8 is very important, because in pediatric hospital nowadays is moving from being a conventional normal hospital to where people can stay, where children can stay, enjoying themselves, and even cooperate with the health caregivers in order to give them the best healthcare services. Evidence-based design is one of the trends that is even it's of important because issue of come first before any other trends can be introduced or element considered. This is what we call why you use empirical data or research to shape architectural design decision. And it's by doing, you conduct a post-occupancy evaluation on your building that has already been built to really to know which of the method or the element or the design features are even really working. So based on this, the information gathered, the feedback gathered will be made to improve on the designs that is coming up. You, of course, you learn what part of the evaluation, what part of the building is working or what doesn't work. When you are designing, it's better to conduct this evaluation on past buildings and know what problems are in the designing based on a proven outcome. There are so many evidence-based designs that has been worked upon by researchers and scholars. And of course, one of the interesting one is that of Rogers, which has been conducted using a natural lighting to test the recovery process of a patient, a blank wall against a window. You notice that for a period of 7 days, 2 patients were, of course, tested to know which one recovered better than the other. One placed in the brick wall, the other placed in the ventilated, well-airy room, and they can recover faster. But they noticed that the one that windows that was placed at the side of the window cross ventilation area recovered 3 days earlier than the one at the brick wall. That's prove a record, of course. So, of course, we establish the fact that windows, ventilation, airy space, and lighting is really important in recovery process of a patient. So this proves so much when you're talking about the light, the noise, and especially the space use. Now, from the trends that we've already highlighted earlier in this presentation, I tried to look at some case studies, real case studies that we were talking about that really put into consideration what we have discussed earlier on a particular trend and emerging trend of the healthcare. One case study is Evercare Hospital in Lekki. And in terms of energy efficiency, of course, they received health certification as a resource building and environmentally designed building. Was able to reduce energy usage by 20.50% and consumption leads to 42.0 compared to other local benchmark, which makes it one of the talking about the sustainability and talking about the resilience. It's past a major, and even in its component, in the element in the particular building, there are adaptable spaces which can be converted and be, of course, attend to the diverse needs of patients, which is of a very good case study for us to even serve as a design sample to help our design faculty to great healthcare facility design. 2 is Al Daya Health District in Doha, said the integrating healthcare with sustainable living with emphasis on self-sufficiency, generating its own energy, introduce polymodular layout, which is part of the trends that we've mentioned earlier. You can convert those spaces into multiple uses, which is, of course, a freelance polymodular layout dedicated to different patient needs. Of course, they have access to nature and outdoor spaces, which makes it one of the supporters of the trends that have been mentioned earlier. 3 is the Maggie Yorkshire in Leeds in UK. Of course, they make use of a greening that is the how green supported the recovery of patients. Of course, it's not basically the real healthcare facilities, but it really supported the therapeutic design processes of patients, which you can recover faster, cool your knowledge, and cool your brain. Architecture based on environmentally friendly materials was used to suiting the environment and make sure the recovery process of individuals become easy and friendly. This is part of architectural work that contributes to health and well-being of individual as a group and a nation. Course study 4 is an hospital, children hospital adult in China. They focus on a pediatric care and incorporate modern technology. design elements including healing gardens, play area that create more welcoming atmosphere for children. And they prioritize natural light and eco-friendly materials, not so rigid. Technology-based was slightly locally, but in fact, on the natural lighting and ventilation, it's particular the benchmark or the design concept beside at the back of the designer, which make it a very sustainable and resilient in architecture. Of course, providing itself with natural environment that can really contribute to patient recovery system. Pavilion and Permessing is a technology hub. What I mean by technology hub is supporting the tech, integrating technology into the design. All the facilities and the wide stress and the patient recovery process, the wayfinding system is IT integrated and uses natural lighting and provide vast view of Philadelphia. It's a sustainable, you have a saving system, energy saving system, and green roofing. And of course, adaptability and flexibility comes into design as well to make it one of the building that supported real trends in providing a sustainable healthcare design and one of the most technology advanced hospital buildings. Now, coming down to Nigerian context, after these case studies and what can give us an issues or problem that we can be looking at, that architects at the back of mind can really put, there is nothing that we can come up without challenges or constraints. And one part of the challenges in the Nigerian context is limited funding in high-tech, healthcare, and green infrastructures, inconsistent power supply and maintenance, regulatory gaps in healthcare construction standard codes, the lack of trained professionals in healthcare-focused architecture. Healthcare architecture is becoming more vast in an advanced country, but basically in Nigeria is still in a slow pace, which of course we've not realized the need for us to really concentrate or really put as important as possible on this specialized building system. Of course, the cultural and climatic and local supply chain constraints, we still have it there. The issues of getting sourcing for our own local materials to help the sustainable building for our healthcare buildings, or to get in touch with what is the cultural values or what our diverse cultural interests, of course, to design as we want to design to really reflect the position or really reflect what our own set of people really want, the preference in what most of the design in healthcare buildings in Nigeria, especially, is maybe an imported design, so to say. There's a need for us to really concentrate on our own cultural styles, the cultural values we have, the system we are living in, and also to maintain what goes in and goes out of individuals. So it's a very important step to take. Cultural, climatic, and local supply chain is one of the important challenges that we are still having now without adapting the norms. So by so doing, we should be able to create an healthcare construction standard to regulate these gaps in healthcare designs in Nigeria, especially. Future outlooks and recommendation. Most of the important design architects should bear in mind should invest in a modular scalable design for rural areas. What do we mean by modular and scalable design in terms of flexibility, adaptive, which will be able to address all or diverse patient needs or individual needs, strengthening the local green material supply chain. Then, of course, integrating the technology part of it, collaborating with the technical partners for smart integration, decentralized care models. It's getting outdated, getting a solid hospital or a big hospital building without really knowing the functions, and wayfinding become problem. Getting the productivity of even the healthcare staff in the building become a problem. It's a night time we decentralize all these care model styles or systems in information where patient can easily, without stress, accessing these services without stress. But how can we goals that will be able to provide a building that really supports the patient outcome. Smart room, of course, where patients to have his own personal control and how to differentiate from the patient being at home and being at hospital will be very difficult, because once you get to the hospital and it's like you are comfortable, it's an home-like structures, you don't need to worry. And of course, getting easy with the services will be very important. And even the staff and the caregiver will also find their job easy to maintain. Then it's an high time we emphasize training and policy reform for healthcare architecture in Nigeria, because it's becoming vast in the global settings, and it's now time we have an healthcare institute or a specialized area where healthcare architects can have a continuous training to further broaden their knowledge and how they contribute to the design sector in particular. Conclusion. Part of what we really went through, of course, the design really impact patient care. Your design as an healthcare architect or going to hospital design really have something to do with patient care. It's not just designing as normally or ordinarily designing for general. You have to study how the patient will react to your design, how the patient's need, the contribution of this healthcare system into the particular design. And those are the trends. What are the trends of contributing when you are talking about sustainability, you are talking about scalability, you are talking about a patient-centered, that is patient-centric design. Of course, you are talking about resilience into what you are using, and one of the major important thing to consider is infection control. Infection control has become more important in getting a key fundamental element of designing a sustainable healthcare architect. Patient-centered design, flexibility, and technology integration, sustainability, behavioral pattern of the patient is to be at the back of the mind of the architect while you are designing. And of course, the cultural difference should not be escaped, where cultural value differently should be maintained. Mediating room, giving it to what it takes in cultural diversity. Then integration of technology should, of course, be a vast thing that architects should put in consideration while designing this specialized building. And wellness, of course, is the key. To a robust wellness leads to a patient happy wellness and supporting the SDG goals 13, which is health and well-being. Of course, what is so much essential is balancing the innovation with cost context and its practicability in all sense of responsibility. Actions. We are looking into the action. How can we get this done without any slowing down the event of what we want to do? We'll prioritize affordable innovation in design strategies. Prioritizing this affordable innovation is what will make our cost in building as an architect at the back of your mind or at the back of one's mind to designing a perfect strategy. How can I make my design affordable? How can I make this building sustainable? How can I make the building infection control? How can I integrate smart technologies into this design? And by doing this, we have to have a stakeholders engagement, talking with the caregiver, talking about the users of this particular facility, getting to know what they want, what they really needed, and what are their diverse interests, which should be taken as a consideration. And two, collaboration. Collaboration in terms of technology experts and to make a smart hospital design, make a smart hospital spaces, make a smart technology, virtual telemedicine, health, and IoT of a thing to put in place. Of course, we can do all this by piloting a project. As an institute, or let me just put it this way, it's very important as day goes by, emerging trends, all those trends that we have come across, it's very of a necessity for us to have a pilot project, putting in this consideration of whatever we've gathered as an evidence-based design factors that can be input, and submitting this case to a regular healthcare institution for test running or prove it, so that we will have a feedback from it front far, so that it can help the design of an architect. This great pilot project will give room for us to really put it into practice, everything with design concept has arrived in, and putting in practice, how do we engage in the perfect design for future generation and year to come. This will make Nigeria to be one of the Nigerians architects to be one of the professionals taking care of these particular activities as time to come in the nearest future. Thank you for your attention. I think it's an interactive section for me. It's not just one waiting, and I want us to discuss your thoughts and questions, which will be able to give more justice to what I've discussed so far. Thank you so much.
Thank you very much, Architect Afolabi. That was a very, very rich presentation. And I would ask our members to raise up your hand if you have any questions. And if you don't want to speak, you can as well just drop a message in the text box and then you can read it out. If you don't have a question, you can decide to add to this conversation. Just as a pickup from where you ended, Architect Odi, I think it's good that we also understand that there are various approach, to the hospital designs, which because there are different kind of hospitals. The pedestrian hospital has to do with more brighter colors, warm area where children are happy to be, play areas and all those are also part of the design. If you're doing maybe like general hospital where there's a theater and all those things, then you don't have to maybe go for more general approach. I'm not a master in this, but I'm just trying to speak from the little knowledge that I have, because I've been opportune to be in what's this hospital in Ikeja? Duchess, and I can tell you it's such a good hospital, nobody wants to go to the hospital, but from the architectural eye or the view of it, it's well designed. And I think it might not be a bad idea, if we can maybe as a chapter arrange a tour of one of these medical areas, either Duchess or Evercare in Lekki, and just go there and see how these things are done for the sake of knowledge. Thank you very much for this very, very well put together presentation. I would yield to the General Secretary to continue moderating as per questions from members. So please, let's feel free to ask and then join up in the conversation. General Secretary. We can't really hear you.
I can't really hear you.
Okay, let me continue, General Secretary. Okay, so I have hands up here. I can see Architect Bayo Gumefun, please. You have the floor. After you, we'll take Architect Bolanle Olukare, and then we'll have Architect Taiwo Ayepe and Edafe will come after that. So Architect Bayo Gumefun, please. You can unmute yourself, sir.
Okay, good evening, my chairman. Can you hear me now?
Yes, loud and clear. Good evening, sir.
Okay. Yeah. Thank you very much, Dr. Afolabi Oni Adeyemi Olabode. Well, I hear you very well, and I must confess that, yes, it's a pleasure being at this particular CPD. I really enjoyed so much about what you talked about, how you need to consider so many things in dealing with care homes, hospitals, because really you are dealing with vulnerable people. And when you deal with vulnerable people, there are so many things that that becomes very important. You mentioned the fact that the people using the hospital healthcare facilities must feel safe. And I was waiting to hear more about the safety you're talking about, but apparently you were a bit silent on the safety. So I thought, okay, perhaps let me just add my voice to my understanding of some of the safety. Very recently, we had the fire at Marina, which becomes a very critical thing to look out for when designing for health facilities because of the kind of people that you house there. So one very critical factor that I think we also need to consider is, okay, how do the people who are using these facilities in the event of an emergency, how do they evacuate? A lot of them definitely, or let me know, a handful of them definitely will need support to evacuate. And because some people need support to evacuate, and even those that don't need support, how quickly can they evacuate? I mean, seeing what happened in Marina, that even able-bodied people couldn't evacuate in good time. You understand? So we need to start looking at other things that is being practiced worldwide in terms of evacuation of vulnerable people who use health facilities. We've got a lot of compartmentation issues that we need to start to think about in our designing, especially when it comes to this set of people. We need to look at the numbers that you are keeping in a particular compartment, because what really happens, what should happen really is that if there is an outbreak in one compartment, because the people in question are not fast enough to evacuate the premises, you should be able to move them from one compartment to the other, at least for some time before you progressively move them out, because theirs is a different ball game. So that's the side I think I need you to add up to your presentation, because honestly, I think if it's remotely possible for you to share the presentation with us at the end of the day, I mean, it's good to be able to have something to go through. But if you can also look at that part of fires, evacuation strategy and the rest for vulnerable people, that would be fantastic. Thank you very much. I yield the mic.
Thank you, sir.
Architect Afolabi, would you want us to take everything together, or you want to respond?
Let me respond to that sample. Yeah,
Please
thank
go
you,
ahead.
sir. Architect Ogumefo. Yeah, safety is one of the important key areas that needed to be considered when you are designing a hospital. And the fire safety of the building is one of the safety issues that we have in healthcare facility that an architect needed to be to consider while they are designing. One, under the safety, we have the patient falls. Patient falls, one, is one of the safety measures, safety issue that we're talking in hospital buildings. Two, we have the wayfinding of both the patients and the staff, or the healthcare givers, or even the visitors. Three, we have the safety in terms of the comfort and the personal control in an healthcare buildings. Let me just quickly, then the fire which you mentioned is another area of the safety measure which is under the safety in terms of considering for healthcare design. One, under this patient fall, we have a varieties of falls in hospital design. And while you are designed as an architect, patient falls in hospital design is a very important issues that needed to be considered wherever you are designing. In terms of the surface materials you use, the component of the construction materials in the building itself, which can contribute to patient fall, is one thing that needs consideration, while as an healthcare architect needs to consider. Two, wayfinding. Wayfinding is very important safety measure, whereas, when you are talking about wayfinding, is how can I get myself from point A to point B? How can I get myself to the examination room? And before you know it, the patient or the visitor become more confused. So you are not safe in that particular area. So it's one of the areas too. The third one, which is the patient control system. Patient control is like having a personal control of itself. Do you feel safe in that particular space provided by the architect? Is it more welcoming? Is it more reliable? Is it more safety? Then the third, the one that you are mentioning, architect, which is the fire safety itself, is by using materials. You cannot, yes, I will talk about the evacuation. Evacuation in the hospital building or in the healthcare facility is another area, especially on that safety, because it has to do with plans. That is the design, the plans orientation one level to another. How can you make your design more flexible, which I've earlier mentioned, enough for a patient to get evacuated? And of course, you have an exit. How wayfinding work in that particular sense is getting a good control of signs, digital signs, digital controls, which way getting the way out, getting your way in, and how to know where you are in a particular. Some hospitals uses these logos. They use part for wayfinding system and monitoring devices to check their patient and to check out the evacuate. In case of the fire that you are talking about, the plan itself contributes to designs or to get the evacuation techniques of how you get. And there's a what we call a space syntax theorem in particular healthcare design, which can facilitate movement of even both staffs, both the vulnerable, both the ill out of the patient, and everything still has to do with the design of the floor plan itself. By making it wide enough, making it scalable, making it where you can have a choice of fire safety. In terms of materials too, including fire-rated walls, doors, and the floor can help slow the spread of fire, of course, in the building. And in terms of the patient getting themselves evacuated from the building, is particularly showing a real way sign design or wayfinding pattern monitoring device in the hospital, or getting your more design, not complex, or way more easily open plan to really navigate your access or navigate your exit from this particular building. I think by that, I've taught the fire safety and other safety measures that we need to consider when we are doing the design of healthcare facility.
Thank you very much, sir. I think the next question is from Actor Taiwo Aipe. Please, in a minute, can you say your question or your contribution? Thank you.
Okay, Architect Afolabi, thank you so much for your very robust presentation. I happen to have a bit of experience in public hospital delivery. I work with the state government, and what I do is delivery of public healthcare institutions, general hospitals, tertiary hospitals, and the rest. One of the most critical challenges we have is how to manage renovation of hospitals that are in use, typically because it's very difficult for you to evacuate, patients as is. So, I mean, in your experience, I'm now asking from the town and down approach. How best do you advise that this is managed, seeing as there is need for, us to manage growth of existing hospitals, and we really cannot shut down, especially public hospitals as the case is. Thank you very much.
Thank you so much for the question. Renovation of hospitals or remodeling of hospitals at the back of an architect's mind or even the client, there must be a reason for why you want to renovate. There must be a clear goal. What are the aims? What are the aims? What do you want to achieve after renovating? Is it to improve the patient's needs, or is it to improve the nurses on how they contribute to the effective monitoring of the patient? Is it for the patient to reduce the falls, or is it for us to improve a communication in terms of nursing stations, nurses centralized and decentralized zones in hospital? So first of all, the design or the remodel or getting new for this hospital must be established first. This will give us the way, or give us the chart or a path what to consider, how to schedule the renovation schedule based. One, if it is for you've gotten a feedback, you've gotten an assessment from the performance of the building, and of course, you'll be highlighted of what you need to redesign or what you want to remodel in that particular space. the section, I will advise that section hospital renovation is done by section by you have to put it in phases, so to say, phase design, because your achievement, I mean, why you are renovating must be first at the back of your mind. One, do you want to increase patient nurses relationship, or you want to prevent falls? This will give you a type of a strategy to use while renovating. So, but phases, getting your patient out of the space is more or less challenging, but it's still doable in sense of once you get it in your phases design, you'll be able to touch one end and touch the other end. Of course, before you commence the renovation, some people just boxed into the hospital, started breaking walls, doing this, doing that. It's not, because of course you don't know, maybe that is really what the patient or the staff working in the hospital really need. But if you understand that perspective of where they're coming off, that this is what is contributing, the feelings and the process of getting your site or your project or getting it renovated will be in phases, and that is where collaboration comes in with the staff, with the visitors, and the forms of it. Then you'll be able to split it into phases so that they can move into one space and the other. You cannot just enter the hospital and start renovating the whole area at once. The phases, of course, from the feedback and the strategy you use to get it done. With that, I think I'll be able to address your area of concern in terms of evacuating hospital patients from the hospital while renovating hospital facilities.
Yeah, thank you very much, sir. We have Olukare Monica. Please, can you give your contribution or say your question in a minute, please? Thank you.
Okay, thank you very much. Good afternoon. Thank you, Dr. Oni, for the presentation. I'm inspired. I think our schools of architecture should start to allow specialization in different aspects of architecture. My question is concerning, you said we should kind of like our own Nigerian way of design, kind of. But I feel that we do not have a Nigerian architecture per se, because a lot of the medical practices that we have are actually imported. So I'm wondering, what is the Nigerian thing that we have that we can incorporate, or that should influence our own design of hospitals?
Thank you so much, ma'am, for the question. Yeah, I think I mentioned it during my presentation that the cultural diversity of our home architecture is very important. First of all, we really most of the hospital design that we imported most of it into our systems. But do we have time, or have we really sat down and look at it? What are our own needs? What our own patient needs? What our own visitors need? What our own preference? We have so many design of hospital. We have so many these hospital designs. We have so many ward design layouts, where from going from cluster to corridor, from courtyard method, from double corridor to duplex to cruciform. All these typologies of healthcare facility is being borrowed from European countries or from advanced countries, so to say, to speak. And this ward, we have Nightingale ward, which are the major open plan spaces that we use in Nigeria. Now, by so doing, the cultural diversity of Nigeria, we have different types of beliefs, which must be incorporated into the design that we are working on. If we can really establish this type of consideration in our own healthcare facility, we'll be able to sustain what we are designing for our people. One, what are the needs? What are the behavioral patterns of the patient? What are the behavioral pattern of our system? The way we Southwest people, maybe Yoruba, so to say, behave is different from the way the Northerners behave. We are addressing the cultural diversification, cultural interests of what they need. Now, this is how to go about it. We have coping strategy which we can use in our healthcare designs. Why can you find out the preference? What they design, is this what better for them? So why we energize our thinking on this particular space, let us know what they really want, what is contributing to the success or to the recovery period of a particular section of the country. Maybe as a Yoruba man now, what are the things that I want? What kind of traditional or whatever way that can really equip me to even cooperate with the caregivers? So I think there's a more to evidence-based design in part of the trends. And that evidence-based design will give us a special or a specific unit on how to design for a particular people or particular project. In Nigeria, where you say we don't have a culture, I think it's a night time now we start designing based on our cultural values and beliefs. One, really inculcating or whatever into our design, what our people want, what our patients want, what our style of living. We can, by so doing, establish our own design patterns. And by taking a cross-section of empirical data in terms of nurses' preference, patient preferences in a setting, then we'll be able to highlight and earmark some design element that will be beneficial and useful for our own people. And by so doing, we'll be able to put aside the foreign imported design that we are bound to use. Architects are very, of course, we are forward-thinking people. And most of our design activities, whenever we want to design, maybe when we're in school, we take Archidata, we take best time savers, we look for ergonomics in the design, we look for what can suit with a basic design system. But nowadays, the healthcare system, particularly to promote it, and is beyond that. And let us do our own research for a particular people you are trying to design for. And now come on with your own innovative design, and how can you make it more affordable and design? And of course, without compromising with their own cultural belief. And so by so doing, we'll be able to get our own factor gradually, and we will get there.
Thank you very much, sir. Okay, we have Architect Daffy. Please, in a minute, your question or contribution. Thank you.
Yeah, thank you very much, Architect Afolabi, for the presentation. I'm quite happy that you talked about one of the strategies, for hospital design, being trying to prevent the spread of disease as part of the consideration. So something came to my mind. One of the hospitals in Lagos State, in Alimosho, I think it's in Igondo. One of the hospitals actually located very close to a dump site. So if you get into that hospital, the odor coming in, it's a very well designed hospital, but patients, I wonder how patients are able to survive in that hospital. So I'm actually directing my question to Architect Taiwo. If the state government is aware of the impact of that dump site on the general hospital in Alimosho, in Igondo, then to the speaker, Mr. Afolabi, just to find out if in this kind of scenario, what do you think can be done, to salvage the situation, to ensure that the patients, gets, the best kind of care? Thank you.
Thank you so much. Yeah, I've mentioned earlier that infection control is the crucial part of healthcare design and planning, and is of highest priority when it comes to designing healthcare facilities. Infection control, in this particular case of Igondo that you mentioned, being located at the dump site. Of course, it's a dump site itself, even if it's not, even if it is not an hospital, even people living there is another issue for them as well. And I think it's, of course, creating maybe issues that we might not be able to solve literally without getting government control about it. Of course, the hospital we cannot relocate the hospital, but I believe that the dump site can be relocated. If the dump site were relocated, saving the design itself. Now, as an architect, how do you confront that particular problem with your own design? Now it's about infection control. Most of it still boils down to what kind of design concept that you are really working on, and how can you, once you realize that disease or infection is likely to impact that particular settings, how do I upgrade these hospital facilities to be able to to be able to mitigate against this infection control. Of course, in my own sense, I believe all that the building should be properly designed to as a structure that can fight against infections like diseases. One, all materials that will be used in that particular design, all the construction materials, in terms of the concept, in terms of the exposures, in terms of by so doing, we'll be able to tackle those things. But majorly, it's not supposed to be cited. Even residential building is not cited at the dump site. Dump site should not be even in the town. But I believe that maybe the development match up with the dump site. But as an architect, and we are being confronted with that type of situation, the choice of material, method of containing the infection is an architectural point of view. It shall include so many methods by using different kind of materials in what you put microbial materials, using of developing negative pressures rooms, and developing some evacuation spaces that can really mitigate against the spread of the disease, or in place of the noise, the pollution. So by choice of materials, after you might have identified that it is the challenge of the area, your selection, your choice of material must be very, very straightforward and coincides with what you are planning to do. I think by majorly taking care of hygienic measures, incorporating it into the designs, clean surfaces, using of copper, stainless to in your sanitary facilities, it will of course reduce the infection spread of an infectious diseases. And of course, as an architect, you will have taken care of your own design part and leave the dumping site for the government to take care of as well.
Thank you very much, sir. We have the last hand raised, Ismail. Hello.
Hello, good evening.
Yeah.
Hello, sorry, can you hear me?
Yes,
Yes,
please.
Yeah, all right. Thank you so much, Dr. Afolabi, for the presentation. It was actually very insightful. I just quickly want to touch on two things. Number one, what was mentioned by architect Ayepe, and the other one that was mentioned by first architect. Sorry, I didn't pick that name. So, for the fire strategy, Bio. So I just wanted to quickly chip in one or two things in what they've said. For the fire strategy, number one is that when a hospital design is being done, you actually have to, for your space planning, you have to have areas that you grade those areas of high risk patient, low risk, and something like that, medium risk. So all of those things are the things that will inform your kind of fire strategy, your fire compartments, and all of that. Also, you will need to use some mechanical or electrical devices to help you in terms of alerting people and also trying to make sure that you can contain the fire. So the second thing, and focus so much on the CapEx. So we need to look at the and the topics that are what are.
Sorry, sir, we're losing you. The network, it seems bad.
Hello?
Hello. Yes, we can hear you now.
Hello, sorry,
We couldn't hear you. We can hear you now.
Oh, okay. Because I'm driving, so the reception might be a bit bad. So when we are looking at hospital design, we need to then look at both throughout the life cycle of the project. How do we want to maintain this project? What are the things we can do to ensure that when we need to expand, the ways to do it? And that was why Dr. Ba mentioned about having a change where we need to move. Is also part of it. The main system in how we maintain those things, how I didn't really working and stuff like that. So that's what I want to mention.
Hello? Hello?
Yeah,
I
I think
think
we
it's
lost
done.
him. Yes.
Hello?
Yes.
I'm sorry, the last part of his comment I can't really hear properly.
Okay, I mean, I think he was just trying to comment. So, Ada, maybe you just read some questions
Yes.
that I see
Okay,
in
let me
the...
just read some. There's 2 contributions from the chat. I'll read both of them together, so he can see them. Okay, this is from architect Lawrence Utsaha. The presentation is very informative. Thank you, Dr. Afolabi Olabode. I enjoyed every bit of it and also learned a lot. I may just add the need for functional interrelationship of some spaces, zoning and clustering of some functions. For example, the CSSD works with the theaters with the ICU/HDU, AE and the triage, etc. Practical experience in the functioning of hospitals makes this easier to design for. Again, I say thank you, Dr. Afolabi. Then we have a second comment from Ngozi Ugoji. One of the main human inputs in retrofitting existing hospitals is to ensure that clinicians are involved from the get-go. So from scheme redesign or improvements all the way through the stages to delivery. This helps to ensure that the design is solving relevant problems that led to the identified need to retrofit. The architect should never work in isolation. Okay, so thank you. Okay, sorry, there's one more comment. The presentation is very impactful and informative. However, in our healthcare delivery, the use of building code is very essential in our practice. Fire and life safety, including HSE, should be the major concern in our design and to also ensure non-combustible materials are used in the finishes of healthcare building. Okay, so thank you. Those are the comments from that we have on the chat. Thank you very much once
Yes,
again.
once you read my PS's comments.
Pardon?
He is informing architect Oni about the PS is informing architect Oni about the dump sites in Alimosho. You should read that too, yes.
Okay. Sorry, I can say that. Yes. So thank you, Dr. Ani. Just inform you that the dump site developed over time, long after the establishment of the hospital at Alimosho. The State Ministry of Environment is well aware and making plans to resolve this issue.
All right. Thank you.
Yes, Dr. Oni, you can take your response to all that now.
Okay. Thank you so much. I think one, the healthcare design for healthcare facility design, it's have a different ways, different pathways into tackling the basic challenges which the design must bring. And I believe that everything that has been mentioned is quite important in healthcare facility planning, design and planning, which can be incorporated. But the scope of what I've just discussed is part of the fundamental issues that have been the back of the mind of an architect in while designing healthcare facilities. All other in terms of the maintenance, the life cycle of a building, and so of course will be in the project plan of the design itself. Establishing a building code is one of the important things that one needs to put in consideration in particular settings in Nigeria, where we can develop a policies and a regulatory legal framework that can really back up the design of healthcare facility. By so doing, we'll be able to tackle so many issues that might arise in terms of design, hospital design and planning. So, of course, I acknowledge the speaker that spoke about the risk, the fire everywhere with high risk, low risk, and now to get into a mechanical compartment, and so by so doing, I think it's a good solution. But that is where in my own conclusion, when I was concluding in my presentation, I think collaboration too is a key, because as a designer, as an architect, you need to collaborate. Well, integrate so many things into your design. Healthcare system is a complex design, which one needs to really put effort into creating a sustainable one for the patient or for the users, so to say, in general. But from the spaces, internal spaces in designs of we have different standards and goals. When you are talking about emergency unit, ICU unit, even the ward, and talking about the outpatient department, and so the relationship between outpatient departments and the examination rooms, basically for patients, for users, and for even the nurses, healthcare facility, need to be taken into consideration. When you talk about the space planning of each spaces to make it meaningful, where you can reduce. And this will make me to digress a little bit into emergence of even this hospital design itself. Hospital design problem, it's an evolving one, and it is not settled at one time, because one problem leads to another. One problem leads to a solution. So once try to solve a particular solution in ward layout, you are creating another one. You should respond to the other one. Because, for example, ward designs, hospital ward design is created when we have an open ward, a Nightingale, a normal ward that we always find in the general hospitals, where you have a large space of area. The problem about the ward design, about that Nightingale ward or open plan ward, is that nurses especially find it difficult to work efficiently or move from one space to another, from one end of the hospital to another end of the hospital. So by so doing, we create another design, which is a cluster design, double corridor cluster design. That design solves the problem of the efficiency of nurses, productivity of nurses, but of course give us another problem of ventilation. So while trying to solve the problem of ventilation in double cluster, we open up to a double corridor and a cruciform form in terms of the courtyard. Another courtyard forms, but why wayfinding in courtyard design system of hospital create another problem of long distance. So why I'm saying all this, that while we are trying to evolve in hospital planning and design, we are trying to solve a problem and even to take care of the patient or the users or the visitors that that particular design works on. So if we can come together and work hand in hand with collaborate and in partnership, one will be able to solve this particular design issues basically for healthcare system. And by doing that, we'll be able to generate our own, so to say, our own codes or standard while we do hospital planning and follow-up. I think by doing, there's so many problem issues here and there that need to be solved, and the research is also concentrating on this matter to get it resolved. But while developing ourselves in this particular area of architecture, we'll be able to get it to one of the sustainable one that we'll be proud of as a Nigerian.
Thank you so much. Thank you very much. And we've actually learned a lot from this presentation. And we want to appreciate you for the time you've spent. And to everyone that gave their own contributions, thank you so much. Okay, with that, we've come to an end to this of our CPDP for the month of October. Please, we'll be sending details shortly with regards to the emergency general meeting and AGM. And we look forward to having you there. Thank you very much, everyone. Goodbye.
Thank you. Thank you for having me.